Welcome to It's Your Case, presented by vetcity.com. I am Manuel Pinilla, your radiologist on demand for today. Today's example is a 15-year-old male entire Chihuahua presenting for a 2-day history of lethargy and inappetence. Once you have reviewed the radiographs using your systematic approach, then you are ready to watch this video. I will highlight the most important findings on these abdominal radiographs, and we will start taking a closer look at the lateral view. In this view, the first thing you may have noticed is a very large space-occupying lesion here in the mid-ventral abdomen. If you think of a normal abdominal radiograph, in this area what we would expect to find is the small intestines, but this structure is creating a marked mass effect, so it is pushing those expected structures around it. Particularly, you can see the intestines being pushed dorsally here, and also caudally there. You've got some intestinal loops that are pushed. Cranially, there is also a little bit of a mass effect. I think the stomach here is slightly compressed, is slightly pushed cranially. And some of the features of the lesion is its homogeneous soft tissue opacity. So if you look, its opacity is fairly similar to, for example, the liver. And also its shape is very important. If you look at it, it's mostly rounded, but in the cranial part, when you come here, it's got this triangular projection. There you go. Now, when you look at the lesion on the ventrodorsal view, there are also features of a mass effect. So other than the large opacity itself, which is lateralized to the left, you can see that the small intestines are pushed towards the right. Here, over the mass, you can only identify the descending colon and the kidney. Particularly things like the kidney, they are very fixed in a position anatomically, so they are less often pushed by masses. You can also see part of the splenic tail, although in this view it's difficult to know if the mass is continuous with it or not. One important thing to look in these cases is going to be for signs of, for example, peritonitis, hemorrhage, or abdominal fluid in general. So you need to very carefully assess the serosal detail. And remember, the serosal detail is the ability to see the serosal surface of organs, and we can normally see that if there is fat around them. So for example, if we look at these intestinal loops here, you can see the outside surface of them, and that is because they are in contact with mesenteric fat. The same, for example, here we can see the gas inside an intestinal loop, but we can also just about see the serosal surface. In this part here, we do not have very good serosal detail, but I do not think that is because of loss of serosal detail, just because there is a lot of organs that are superimposed. So all of those intestines that are pushed dorsally are appearing one on top of the other. So I cannot see convincing evidence of fluid. Now, the way this mass is displaced in the intestines and its location, which is to the left of the abdomen and caudal to the liver and stomach, is indicative of a splenic origin. And this shape here that I mentioned, the triangular projection of the mass, I think that is just some part of the splenic tail which still maintains its normal shape. There are some other anomalies. For example, here, if you look, the colon is slightly pushed dorsally by this rounded soft tissue opacity, which in this case is the prostate. I would consider this pretty much normal. It's likely due to some degree of benign prostatic hyperplasia, which is expected in a 15-year-old entire dog. There are some mild spinal changes. Those have been described in the full report that you can find attached to the case. Regarding differential diagnosis, most common cause, I would say, of a big, large splenic mass like this one is generally primary neoplasia, particularly hemangiosarcoma. It could still be something benign, like a big splenic hematoma, for example. As further recommendations, I would suggest before doing anything, maybe thoracic radiographs could be useful to rule out metastatic spread. And you could also consider an abdominal ultrasound, not just to confirm the mass, which we are all pretty sure is there, but to rule out, for example, metastasis to the splenic lymph nodes, to the liver, or to any other organs. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on the social media.